This is Frances Russell, and in this module we will review point-of-care ultrasound scanning technique for the gallbladder. Next, we will image the gallbladder in long axis. Here you want to place your probe in the patient's right upper quadrant, anterior on the abdomen, with the indicator up towards the patient's head. You then want to scan or fan towards the patient's left and right in order to view the full length of the gallbladder in long axis. You can notice the fundus towards the top of the ultrasound screen, and the neck of the gallbladder is down towards the bottom left of the ultrasound screen. Here you can evaluate for wall thickness as well as evaluate for stones. You'll notice that the gallbladder is also a fluid-filled structure, which appears black on ultrasound. You then want to rotate your probe so your indicator is towards the patient's right side. This will allow you to get a short axis view of the gallbladder. Here you will want to fan the face of the probe towards the patient's head and then towards the patient's feet. You want to make sure to scan through the entire length of the gallbladder, visualizing the fundus and especially visualizing the neck of the gallbladder. Again, in short axis, you're able to see stones and able to evaluate wall thickness. This is Frances Russell, and we're going to review point-of-care ultrasound scanning technique for the liver. First, we're going to image the liver. Here you want to place the phased array transducer in the patient's right upper quadrant. You want the indicator, which is indicated by the red dot on the screen, to be up towards the patient's armpit. To image the liver in long axis, you want to slide the transducer or the probe over the anterior aspect of the abdomen and then slide back towards the patient's right lateral side. Next, we'll image the liver in short axis. Here you place your probe in the patient's right upper quadrant with the indicator towards the patient's right. You're going to slide the probe cephalad and caudal in order to visualize the liver. You'll want to notice the liver's echo texture, as well as you may see dark shadows or black shadows coming over the liver. These are off the ribs. While evaluating the liver, you will notice that there are two different types of blood vessels running through the liver. One is your portal venous system, and the other is your hepatic system. The way we differentiate these on ultrasound is your hepatic system has no real visible wall. You can see this by the yellow arrow in the image. You can see a dark structure, a fluid-filled structure, which is a hepatic vein, and you can't really see the wall very well. In contrast, when looking at the portal system, the portal vein, which is indicated by the red arrow in the image, you can see the walls are very bright white, very easy to see. This is an image of Morrison's pouch. So in the central part of the screen, we can see the liver. Just below that, we can see a kidney, which is slightly darker than the liver. The yellow arrow is pointing to the space called Morrison's pouch, or your hepatorenal recess. In patients who are in trauma, who have free fluid in their belly, you may be able to identify free fluid in this space.